We are a group of physical therapists who are also wilderness EMTs and are also university professors. And we have developed a group of people called the Wilderness Physical Therapy Educators. And our mission in life is to provide education for our colleagues in physical therapy and occupational therapy and other medical specialties to learn about how to manage backcountry emergencies.
We're out today on Scout Mountain doing our first hands-on course called Traversing Wilderness Physical Therapy. And it's a primer of wilderness first aid.
And we're teaching those wilderness first responder skills to respond to emergency without the hospital clinic around or the four walls.
Focused a lot on some trauma education. I mean, we did some splinting, we did some tourniquets, we did all kind of good stuff and great training.
Came out here to take this course to get a lot of secondary experience and pick the brains, get a lot of knowledge from the wealth of knowledge the instructors have here on clinical decision making and just how to go about the thought process of managing different conditions, injuries in the wilderness and in the backcountry.
It's very hands-on, like we're able to kind of do some didactic work inside, but come outside, be patients, be caretakers, all of the above.
I think my favorite part was networking and meeting lots of new people. I think that was great. There was a lot of local people, but then there was a lot of people that were traveling from far away. I think that was great to be able to kind of connect with like-minded people.
My favorite part would be kind of learning the hands-on, being thrown into scenarios and kind of learning those skills on what to do. Also, talking to the instructors about all the cool things they've done has been just an extra added bonus.
The course instructors are extremely knowledgeable and have been there. They've been in all these scenarios themselves, so this is really helpful to hear what they did in all these situations and how we could apply that with the materials that we have.
Blah, there's blood. Yeah, good thing we checked.
Please help. I really enjoyed learning more about putting on tourniquets, and I also liked the information and the instruction on reducing joints if you have, somebody that has a joint that's dislocated. So that was actually great information for me.
Something that I'd use from this course is probably like splints and carries. My family spends a lot of time in the wilderness and out of range of like cell phone service and stuff. We have had a few family members with broken bones and stuff like that, so splints and carries would be very helpful in those situations.
I have 4 kids. We spend a lot of time out doing things and making sure that all 4 kids get off the mountain is fairly important. So taking the skills that I already have and being able to expand that and add that extra level of security and safety and brings my mom anxiety down.
It's helped me gain a lot of confidence in my ability to assess a situation, know what to do, know that I got it, I can do this. They reiterate, we already know a lot from physical therapy, and now we're just expanding upon that, which is really awesome.
He said it was good.
Got it secured.
The reason that I learned so much more in this course than any other outdoor wilderness preparation type of course is because they didn't just cover the basics of first aid. They built on the skills and the knowledge base that I already have as a doctor of physical therapy, and that made it an entirely different course and just well worth the travel and the time.
The biggest take home from this is that I still have a lot to know. I'm hoping that if I continue through this path and this program, it's going to empower me to be more of a provider than a victim.
Honestly, I think that this was the most impactful CEU course that I've taken. All courses are hands-on and they teach you things, but this is the only course I've taken that's really been about life-saving techniques when you're out, especially in the backcountry where you may not have cell phones or you may not have immediate access to just calling 911. So I think this has been a great course in order to help me build confidence and learn how to help people when I'm in the backcountry. It's just been an awesome 3 days, learning from great instructors and increasing my knowledge.
And it was a very good class. I would encourage anyone who's interested in physical therapy, any kind of outdoors, I would give this class class a shot, because you're going to learn, you're going to get some great value out of it, regardless where you are on the path. And it's going to probably make you either a better provider, a better hiker, a better anything. It's going to better equip you to be able to handle just about any situation in life with at least a plan rather than chaos.
We're very excited about this program, and we're getting some really great feedback as we move forward. So we hope that you guys will consider joining us.
Pull this up. Wilderness Physical Therapy Educators. It's www.wilderness.pted.com. And we have some other offerings as well that are online offerings that complement this particular hands-on class. And so check it out, enroll, become a friend. We look forward to seeing you soon.
Run the cows!
Watch the cows!
Yeah, be careful with the cows on the way home.